The Picture Dictionary teaches the standardized terminology of the mucus observations. The pictures contained in this dictionary are examples of real observations, but they're not yours, so there's expected to be some degree of variation. Women relate well to the examples in the dictionary. Men also find the dictionary helpful to their understanding of the system. A picture cannot be taken of the sensation the mucus creates, so we're going to verbally describe that at the appropriate time. The 3 steps. There are 3 steps in checking for the mucus. It is important that you establish a routine of observing your mucus in this sort of stepwise fashion so that you can always make good observations. The first step is to observe the sensation the mucus creates. This is done while wiping with the tissue, and you also notice this before you observe the tissue. The second step is to observe the tissue to see if there is any mucus present. And if you do see mucus, then the third step is going to be to finger test any mucus that is on the tissue. It's at this point that the stretchability and the color of the mucus are determined. It's important that all of the mucus be finger tested. We describe this by using the acronym SOFT for sensation, observation, and finger test. The 3 sensations. There are basically 3 sensations that you might observe when wiping with the tissue. These sensations are dry, smooth, and lubricative. The dry and smooth sensations are distinctly different from the sensation of lubrication and can properly be described as non-lubricative. How to wipe. This is a diagram of the opening of the vagina. This is what we call the vulvar anatomy. It is important to wipe from front to back. This is the most hygienic way of wiping, and it's going to reduce the likelihood of a vaginal infection. You should begin wiping just above the urethra, which is right here, and continue backwards over the opening of the vagina between the labia until halfway over the perineal body. You can see that here. Picture 1, dry. When you wipe with this tissue, you will feel a sensation of dryness. This is going to be a very obvious sensation. As you observe the tissue, you will see that it's dry and that it wrinkles easily. Nothing is going to be finger tested from this tissue. Dryness, the feeling of dryness, is generally not a problem for most women since it is such an obvious sensation. Picture 2, damp without lubrication or damp with lubrication. When you wipe with this tissue, you may or may not observe the sensation of lubrication. When you observe the tissue, you will see an area of dampness on the tissue, but nothing is going to be lifted off the tissue for finger testing. The key to your fertility in this observation is the presence or absence of lubrication. The observation of damp without lubrication has the same significance as a dry observation. The observation of damp with lubrication is peak-type mucus. Picture 3, shiny without lubrication or shiny with lubrication. When you wipe with this tissue, you may or may not observe the sensation of lubrication. When you observe the tissue, you will see a damp area with small areas in the center that are shiny. Nothing is going to be lifted off of the tissue to be finger tested. The key to your fertility in this observation is the presence or absence of lubrication. The observation of shiny without lubrication is the same as a dry observation. The observation of shiny with lubrication is peak-type mucus. Picture 4, pasty, creamy, cloudy. When you wipe with this tissue, you may or may not observe a sensation of lubrication. When you observe the tissue, you will observe a discharge that has the characteristics of hand lotion or a flour paste. It may even be milky in appearance if the water content is high. This discharge originates from the vagina and is different from cervical mucus discharge. We call this a pasty or creamy discharge. Often, this discharge is present in a smaller amount than what you see in this picture. Picture 5. sticky, pasty, creamy, cloudy. This picture demonstrates the sticky consistency that could be present in the discharge. In this example, the woman is stretching the pasty discharge by finger testing it between her thumb and index finger. When she stretches it, you can see that it only stretches approximately 1/4 inch. When the mucus stretches up to 1/4 inch, we call it sticky. The pasty discharge never stretches more than 1/4 inch. Picture 6, cervical mucus on tissue. This is what cervical mucus looks like. When you observe, you can see the cervical mucus raised on the surface of the tissue. It will not absorb into the tissue, and it can be lifted off the tissue so that you can finger test. We always recommend that you use flat layers of white tissue whenever you're making your observations. The blue tissue you see in this picture was only used for photographic purposes. Picture 7, tacky, cloudy. When you wipe with this tissue, you may or may not observe a sensation of lubrication. When you look at the tissue, you're going to see the presence of mucus. When you finger test this mucus, it stretches 1/2 to 3/4 inch. With this degree of stretch, we call that tacky. It has a cloudy color to it. Do not give the mucus discharge a color unless it can be finger tested with the color observed directly at eye level. So you're not going to look at anything on your underwear. You're only going to look at what you can finger test. When the mucus is present in small amounts, it can be finger tested by lifting it up from the tissue like you see in this example. Picture 8, tacky, cloudy. It's best to finger test the mucus between the thumb and the index finger. This example shows a very fine thread of mucus, which is tacky, 1/2 inch stretch in consistency, and it's also cloudy in color. On occasion, the cervical mucus will stretch only 1/4 inch, and that's what we call sticky. When it does so, it will stretch into a fine thread, as in this example, thereby being distinguishable from the sticky, pasty type of discharge. Picture 9, stretchy, cloudy, clear, lubricative. When you wipe with this tissue, you may or may not observe a sensation of lubrication, although this type of mucus is usually lubricative. Upon looking at the tissue, you will observe that there is mucus present. With finger testing of the mucus, you can observe the stretchy nature of the mucus, and you can also see the color, which in this case is clear and cloudy. As the estrogen increases in your body, the cervical mucus begins to show peak-type mucus. Peak-type mucus is going to be anything that is clear, stretchy, or lubricative. This example demonstrates the stretchy consistency, which is 1 inch or more of stretch of the mucus. Picture 10, stretchy, cloudy, clear, lubricative. When finger tested between the thumb and index finger, the stretchy consistency and cloudy clear color are easily identified. It's important to note here that when the term clear is used to describe the mucus, this means that there is at least some of the mucus that is completely crystal clear whenever you look at it. In this case, in this picture, there's some cloudy and some crystal clear. Therefore, we call that cloudy clear. This type of mucus can usually be stretched several times before losing its stretchability. Picture 11, stretchy, clear, lubricative. When you wipe with this tissue, you may or may not observe a sense of lubrication, but usually with this observation, you are lubricative. Upon observation of the tissue, you will observe that there is mucus. With finger testing, the beginning stretchy appearance is visible. Often, the peak-type mucus will be crystal clear in color. There won't be cloudy or yellow, it will be crystal clear. While it is impossible to take a photograph of lubrication because it's a sensation, one can appreciate how this particular type of mucus, which is spread on the tissue, would create a gliding effect when a woman wipes with the tissue. The sensation is what women know as lubrication. Picture 12, stretchy, clear, lubricative. The previous example has now been stretched into a thread-like strand of about 2 inches. In this case, all 3 characteristics of peak-type mucus are present, and those again are clear, stretchy, and lubricative. However, you only need one of those characteristics to identify the mucus as peak type. Picture 13, wet without lubrication or wet with lubrication. When you wipe with this tissue, you may or may not observe the sensation of lubrication. When you observe the tissue will be very wet. The wetness often has a glary appearance to it that is different from the previous use of the term shiny. Nothing is going to be lifted off the tissue to be finger tested. The sign of your fertility in this observation, as also as with damp and shiny, is whether or not you have lubrication. The observation of wet without lubrication is the same as a dry observation. The observation of wet with lubrication is peak-type mucus. Remember, you only need one of the 3 signs, clear, stretchy, or lubricative, alone or in any combination, to make the sign peak-type mucus. Picture 14, gummy, gluey, yellow. This discharge is characteristic. It is thick in its consistency, similar to half-dried glue or rubber cement. Because of this, it's given the name gummy or gluey. The yellow discoloration is typical of this discharge, although it may not always be present. It's a discharge that is often associated with some sort of inflammation of the cervix. For example, it could be cervicitis, an eversion, ectropion, or an erosion. Picture 15, tacky, gummy, gluey, cloudy. In this picture, a gummy discharge can be seen showing that it's tacky. And remember, tacky is 1/2 inch to 3/4 inch stretch. This is a characteristic type of discharge that is pretty easily identified by women. The terms gluey and gummy are interchangeable. Picture 16, tacky, gummy, gluey, cloudy. In this picture, a gummy discharge exhibits a slightly different tacky consistency as it is finger tested between your thumb and index finger. Just as a reminder, the word sticky refers to the stretch of the mucus up to 1/4 inch. The word tacky refers to the stretch of the mucus from 1/2 to 3/4 inch. The word stretchy refers to the stretch of the mucus, and it's going to be 1 inch or more. You don't need to have a ruler to make these observations. These schematic drawings illustrate the definition of these terms. Remember the special categories of peak-type mucus: damp, shiny, and wet, but all 3 of those, in order to be peak-type mucus, would need to have lubrication. And also remember the special categories of dry observations: damp, shiny, and wet without lubrication. In each of these, no mucus can be finger tested. Your fertility is determined by the sensation which is created during the wiping process.